What's wrong with healthcare, from my perspective, is that it is a totally unmanaged process.
It is a structure that's focused on repair, not avoidance.
Healthcare in this country costs twice as much as any other developed country.
The current payment system pays more for doing more, and more often than not does not pay more for doing a better job.
We clearly have a crisis when it comes to our healthcare premiums.
Over 100,000 people in this country die from medical errors each year.
If you don't have health insurance in this country, there's a 25% greater chance that you're going to die.
We have about 60 million people that don't have health insurance.
It's a cottage industry that's now turned into the dominant economic expense for our economy, and yet it's not designed as a process. It's designed as an episode piled on top of an episode, piled on top of an episode. And that then results in what we have, which is excessive expense, excessive risk, and quite frankly, mediocre outcome.
The problem is big. It's very big. And I believe after talking about it for years, we're at the breaking point.
Things are going to get worse if a change isn't made.
First, I think we need to not kid ourselves. It's not going to be easy.
The healthcare discussion could not be more complex.
I think the elevation of the discussion about health reform has really created a more dramatic need for better leaders.
To me, at the end of the day, it comes down to a collaboration around a shared vision with strong leadership.
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 One of the first to see the depth and complexity of these issues was Dr. Dan Hanley, a family doctor from Brunswick who became known in Maine and across the nation for his leadership. He was a pioneer in using data and research to improve care. He helped establish the Federal Agency on Health Research and Quality. He developed the U.S. Olympic drug testing program, and he never lost sight of his commitment to making a difference, one person at a time.
When my father died, we had lots of people who came to us and said, we ought to do something in his name. And we really liked the idea of building on his legacy and trying to promote the values that he promoted throughout his life that made him successful.
He really was a mentor for so many boys, and many a night he would come back home very late, and I'd say, "What were you doing?" And he'd say, "Oh, I was talking to one of the students."
I could not even tell you whether Dr. Hanley had been a Republican or a Democrat, but I can tell you that he had a profound influence on healthcare in the state over the many years that he lived.
Today, the legacy and the leadership that Dr. Hanley demonstrated is being carried on by the Hanley Center for Health Leadership with strong involvement by Dan's family.
The Hanley Center is doing the right thing at the right time by bringing people together to collaboratively work on issues.
Leadership development is all about drive and vision and but it is rare to hear that term collaboration.
Well, I think the Hanley Center's focus on collaborative leadership is a unique function that really nobody else in the state or the region serves right now, and I think that is making a big difference.
Our overall mission at the Hanley Center is over time to create a greater culture of collaboration.
The Hanley Center has 4 major programs. The first is the annual Health Leadership Forum, which brings together leaders from throughout the state. The forum tackles timely issues such as youth obesity, the future of primary care, and Maine's new health infonet system.
This is the first forum that I've actually attended. I think it's a great format, bringing subject matter specialists to the table and allowing and permitting people in an open forum format to be able to just kind of, ask questions out loud and be provocative if it needs to be.
Health Infonet is the direct result of that collaboration, that effort to build a point of consensus.
The Hanley Leadership Award recognizes an individual or an organization that's making a significant contribution as a collaborative leader.
Winning the Hanley Leadership Award, knowing what it was about and the quality of the people involved in it was just overwhelming. It was an incredible honor, especially knowing Dan Hanley's legacy.
Through the Hanley Fellows program, a leader who's poised to make a difference is paired with a mentor who can help them bring about positive change in healthcare.
I'm very excited to be a Hanley Fellow. I felt I needed someone who could actually afford me the opportunity to hone my leadership skills, to understand how to step out of my day-to-day job and identify ways that I can both research and then implement transformative change, things that go beyond the four walls of our organization.
The Hanley Center's statewide Health Leadership Development Program, a partnership with the Institute for Civic Leadership, selects 30 experienced professionals each year for an intensive course aimed at developing a statewide network of individuals who can lead change through collaboration.
I think the participants have viewed this as enormously successful to themselves in helping them develop their skills. The people brought back fresh energy, new ideas, new skills of leadership, and especially around the issue of collaboration, working with others to make good things happen.
The Hanley course and the practicum projects gave us perspectives, tools, and opportunities to address actual challenges in our communities and to make more of a difference through collaboration than we could as individuals.
If we look at the Hanley Leadership Program, bringing people together from all across the state, from different elements of the healthcare industry, be it physicians, hospitals, public health, insurance, all the different components, and having them figure out that their interests are more aligned and more alike than different.
The small staff, they've been able to have the kind of impact that you wouldn't expect an organization to be able to have, and it's a challenge to continue to provide that and to grow the way it needs to grow.
What the Hanley Center is doing with its leadership fellows and its leadership training is basically preparing the next wave of people that I think will be responsible for making really major changes in the way healthcare is delivered in the state.
I think it's innovative. I think it's opportunistic. It's certainly timely with the debate currently taking place.
When we thought at Mercy about supporting the center, both financially and sending people through the program, it was really an absolute no-brainer.
The Hanley Center's role as a convener and as an educator for those individuals that want to have an impact on healthcare is critical. I think funding this program is also critical.
We have to be able to step beyond the more concrete, tangible kinds of things that we're used to paying for. We have to be able to invest in vision and leadership and courage and all those kinds of attributes that Dr. Hanley embodied so well.
The problems are huge. It's the biggest domestic issue of our time.
It's going to take courage from all of us to change. It's a lot easier not to change.
If the Hanley Center weren't doing it, somebody else would have to do it because it's absolutely essential.
We have the right people. We now need to give them the support, the tools that they need in order to make a difference. The Hanley Center has accomplished a great deal with limited resources. Today, the center is poised to extend the reach and the impact of its programs by developing new generations of leaders who will work collaboratively to address the tough health issues Maine faces.